Antituberculosis or antimycobacterial agents. Indications, so these are for prophylaxis or prevention with exposure to TB or mycobacterium, as well as for treatment of active TB or tuberculosis. So side effects include hepatitis, so it's very toxic to the liver, and as well as nephrotoxicity. Patients with vitamin B6 deficiency or pyroxidin deficiency, it is common that INH or isoniazid will increase the risk of peripheral neuropathy or cause peripheral neuropathy. Precautions include liver and renal disease. Contraindications: anytime there's an acute or major liver or renal disease, these medications are contraindicated. So nursing actions, so diagnosis. How do we diagnose somebody with tuberculosis? So the most common way is through the acid-fast bacilli test or sputum testing for the acid-fast bacilli or AFB. In addition, culture and sensitivity can be done. It helps the clinicians to come up with the appropriate drug to be used for their specific infection. Now, LFTs and hepatitis profile are monitored, as well as your CBC, your BUN, and creatinine. Now, it is very important, especially for patients that are likely positive or they're suspecting that the patient is positive for TB, that we observe them. So we have to have direct observation of treatment to make sure that the patient is taking their medications. So in addition, it is very important to properly refer them to the health department, as well as getting their family treated. So let's say you have a patient who has been exposed or currently has active tuberculosis. So the public health department needs to be notified in order for them to address that issue. And usually they will have to treat the family members as well, especially the ones who are in close contact to the patient. Although not included here in the list, I just wanted you guys to be aware. Well, I'm sure before coming into the nursing program, you were probably required to get this testing done. Another test used to diagnose tuberculosis is your TB skin test. It is not absolutely positive whenever you have a positive skin test. So whenever a patient has a positive TB skin test, then they may require additional testing such as a chest x-ray. Now, the gold quantiferin serum blood test is more accurate, and it will give the provider an idea of a current active TB infection. That being said, the insurance companies don't always cover the gold quantiferin serum test. So sometimes if it's not covered, then we have to use the other tests available to us, which is commonly the TB skin test, as well as chest x-ray. So some examples of drugs that are considered antituberculosis include isoniazid or INH. So this medication is used as prophylaxis with exposure and as well as treatment of active tuberculosis. Now again, because of the possible side effect, it is very important that a patient is on vitamin B6 supplementation or paroxetine supplementation to prevent that nerve problem that can develop from this medication. So again, if your patient starts experiencing nerve-related symptoms such as tingling, numbness, and all that after starting isoniazid, it may be a good idea to start the patient on vitamin B6 supplementation. Rifampin is another medication that we use for TB. So for rifampin, what we have to remember is to educate our patient to ensure that they take the medication on empty stomachs. And we have to warn them that this medication can turn their body fluids to red and orange. The reason why this is very important, you don't want them to panic thinking that they're bleeding somewhere else. Let's say they go to the restroom and they urinate and their urine is red. They may start panicking if you don't let them know ahead of time that this specific medication can change the color of their body fluids to either orange or red. This is also used for other kinds of infection depending on a culture and sensitivity, but commonly this is used for tuberculosis. Pyrazinamide, this medication, so the only thing that you have to remember about this medication is that it is contraindicated in severe hepatic disease as well as acute gout. Another medication is ethambutol or myambutol. So this is contraindicated in children less than 13 years old. So again, this medication, such as your rifampin, can be used for other sorts of infection based on those cultures and sensitivities. So although this is used for tuberculosis, you may see this medication being used for another type of disease process or infection. Lastly, you have streptomycin. You don't have to remember this. This is not used as commonly as the other medications. Next is HIV or AIDS agents. So indication, it can be from exposure or infection. So if the patient has been exposed to HIV virus or if they have an active infection with HIV. In addition, these are also used when a patient has been diagnosed with AIDS or acquired immune deficiency syndrome. The goals for the treatment usually include the viral load of less than 50 copies. So this is the amount of HIV in the blood, so the number of copies of HIV RNA in a milliliter of blood. The goal for CD4, or CD4 is basically the cluster of differentiation for glycoprotein found in the surface of immune cells such as the T helper cells or monocytes, macrophages, and dendritic cells. So the goal for this is greater than 200. And in addition is for the patient to not have any opportunistic infection. Side effects include nausea, vomiting, and diarrhea. In addition, this can also cause bone marrow suppression as well as osteoporosis. Protease inhibitors can lead to diabetes and dyslipidemia. Precautions include concurrent infection with hepatitis C and tuberculosis. Now, it is very important to take in consideration that this drug has multiple drug interactions. Contraindications, so anytime there's a known severe drug allergy or if the patient is unable to tolerate the side effects or adverse effects of this drug. Nursing actions include following the viral load and CD4 counts, especially because we want to know if our goals are being met. Now, we also have to monitor for side effects and as well as monitor for opportunistic infection, especially because we know that this disease process can actually weaken a patient's immune system. Examples of drugs in this class. So there are different kinds. So there are the reverse transcriptase inhibitors or RTI that inhibit DNA synthesis. Then you also have your protease inhibitors or PI that inhibit protease retroviral enzyme, and you have your fusion entry inhibitors which inhibit the HIV fusion to the host CD4 T lymphocyte. So the reverse transcriptase inhibitor or RTI include efavirenz, zidovudine, and efavirenz. Under PI or protease inhibitors, we have ritonavir. Under fusion entry inhibitor, we have enfuvirtide.